If you're on a cancer pathway, it's very important to involve friends and family for support, because very often you don't know what's going on. You're putting one foot in front of the other just to get through the system. So when you're asked to go for an MRI appointment, not just your time, it might be your wife, partner, somebody else in the family who should be going with you to help you through the process. If you can talk to someone about this, it's much easier to arrange. Otherwise, you get a series of linear arrangements. Somebody phones you, somebody sends you the date, you have to get back to them, and you go backwards and forwards, backwards and forwards. It's much easier to do it person to person, or these days online when you're given a selection of appointment dates. I was given information about that, but I don't think I took it on board. I just turned up. It's very hard when you've had a cancer diagnosis to concentrate on anything at all. All you're thinking about is the next step. And very often patients perhaps don't want to take the next step, because if I don't take it, then I haven't got cancer. But all you can think about is the next step. And that's what you do, one step at a time. My consultant was very good. He insisted my wife come with me to the appointments. He may have explained what was going on, but I don't think I took it on board. But what was useful were the Macmillan books. They enabled me to take little chunks of information and look at it bit by bit. I suspect that we were told what was going on, but I don't remember. The first time I had MRI was orthopedic. I had footballers' knees, so I had lots of MRIs while all that was being sorted out. And that was quite straightforward. I wasn't worried. I was in the hands of a good surgeon. I knew what he wanted to do, and he showed me the MRIs as well. So we just got on with it. Cancer is completely different. It's scary. It's life-threatening. You don't know what the end is going to be. You don't know what treatment you're going to have. If you're an orthopedic patient, the doctor says, I need to do an operation on your wrist. Before that, on MRI, just to check everything. That's fine. With cancer, you don't know. Again, one step at a time. I think if you've never had an MRI, you do need preparation about the MRI process itself. You need to be told about the tunnel. You may or may not be in the tunnel depending on which part of the body is being MRI'd. You need to be told about the noise, the changing frequencies, roughly how long it will take, although you've got no idea of the passage of time. Some people are claustrophobic and won't go in the MRI tunnel. My wife won't. She'd have to be sedated before she went in there. My technique is to close my eyes. In fact, I didn't realise that my trunk was in the machine, but my head was outside, so I didn't need to close my eyes, but that got me through. The CT scan was different because I had the diagnosis of cancer. It was much more scary because the doctor said to me, you need to have a CT scan to see if the cancer has spread. At least he told me why I was having it. He didn't say, oh, it's just another check. He told me why. And I think that made me more scared, but more determined actually to do it. Whenever they said, this is your appointment, that's fine, everything else can wait, go for the CT scan. And I was scared, I was nervous. It's difficult now when I think back, because you know you've got cancer, and they're seeing if it's spread. It is scary. Not quite sure if I could admit how scared I was. My wife knew I was scared, but I wasn't talking about it because I'm a man and we don't. The staff were good because they knew what it was for, because I had to have the dye beforehand. And I'm not sure, it is difficult thinking back. It was mechanical, it was one step, something else I had to do, and I don't think I reflected properly on it until 2 or 3 years afterwards. I mean, maybe now is better because I know, I've just had my 6-month PSA check and I'm waiting for the result. But so far, I've been okay. Helps me to look back. At the time, no. Just get it done.